Measles is a systemic viral infection caused by a paramyovirus. Its main features are fever, rash, and respiratory disease. The public health significance of measles is that it is highly infectious and can be prevented by vaccination. Clinical features. In an unvaccinated child, there is a prodromal illness with a high fever and a coryzal respiratory infection. There is cough, conjunctivitis, and runny nose. Koplik spots appear during the early stage of the illness. These look like grains of salt on a red, inflamed background and are found on the mucosa of the cheek next to the upper premolars and molars. The rash of measles starts on day 3 or 4, initially in the hairline, but spreads rapidly to cover the face, trunk, and limbs. It is maculopapular, but not itchy. Koplik spots fade as the rash appears. The rash fades over a week to 10 days. In a vaccinated child, the illness is usually mild, with a low-grade fever, transient rash, and absent respiratory features. Complications of measles include pneumonitis, secondary bacterial infection, especially acute otitis media and pneumonia, and encephalitis. Complication rates are higher in malnourished or immunosuppressed children. Subacute sclerosing panencephalitis is a late, slow-onset progressive complication that occurs in about 1 per million cases. It is always fatal. Laboratory confirmation. Measles IgM can now reliably be detected in saliva if the specimen is collected between 1 and 6 weeks after the onset of symptoms. Transmission. Man is the only reservoir. Carriers are unknown. Spread is from person to person by direct contact with nose and throat secretions or respiratory droplets.
Less commonly indirectly by articles freshly soiled with nose and throat secretions. Acquisition. The incubation period, to onset of fever, is 8 to 13 days, usually about 10 days. The period of communicability starts just before the onset of the prodrome and lasts until 4 days after the rash appears. Natural infection provides lifelong immunity. Prevention. Vaccinate with a combined measles, mumps, rubella vaccine. 2 doses. The main purpose of this second dose is to protect children who failed to respond to the first dose. It also boosts waning vaccine-induced immunity in children who did respond to the first dose. The only contraindications to measles vaccine are immunosuppression, allergy to neomycin or connomycin, and a severe reaction to a previous dose. There is increasing evidence that measles vaccine can be safely given to children with egg anaphylaxis. Vaccination should not be given within 3 weeks of another live vaccine, except OPV, or within 3 months of an injection of immunoglobulin. Suggested case definition. Suspected case. Fever, greater than 38 degrees, if measured, plus rash, plus 1 of conjunctivitis, cough, coryza. Confirmed case. 4-fold or greater rise in measles IgG in blood.
Measles. Rubeola. Causative agent, RNA paramyxovirus. So far only 1 serotype known. Incubation period, 10 to 14 days. Source of infection, cases. Carriers are not known to occur. Mode of transmission, air droplets, respiratory. Period of communicability, 4 days before and 5 days after the appearance of rash. Measles is highly infectious during prodromal period and during eruption. Measles has no second attacks. Lifelong immunity seen. Secondary attack rate of measles, 80%. Measles shows a cyclical trend, increase every 2 to 3 years. Pathognomonic clinical feature of measles, Koplik spots, buccal mucosa opposite lower second.
Most common complication of measles in young children, otitis media. SSPE, subacute sclerosing panencephalitis, is a rare complication of measles, 1 per 10,000 to 100,000 cases, 7 to 10 years after initial infection. Measles is prevented by active immunisation by measles vaccine, live attenuated, strains Edmondson-Zagreb, most common. Passive immunisation by measles immunoglobulin. Treatment of measles: no specific treatment. Supportive measures, symptomatic treatment, nutritional support, breastfeeding where appropriate, ORS. Vitamin A supplementation, all cases of severe measles, all areas with high case fatality rates.
WHO Measles Elimination Strategy: catch up, keep up, follow up. Catch up: nationwide vaccination campaign targeting all children 9 months to 14 years of age, irrespective of history of measles disease or vaccination status. Keep up: routine services aimed at vaccinating more than 95% of each successive birth cohort. Follow up: subsequent nationwide vaccination campaigns conducted every 2 to 4 years, targeting usually all children born after the catch-up campaign. Nepal had aimed to eliminate measles by 2026, as there had been no outbreak since June 2023. Measles can be prevented with a 2-dose vaccine, administered to babies at 9 months and 15 months. The government provides measles vaccines free of charge from health facilities across the country. To declare measles eliminated, the number of cases should be fewer than 5 per 1 million people per year. The country must verify progress through foreign independent verification. For independent verification, there should be no new outbreak for 3 consecutive years.